some news, please. Thank you. Just told me recording's in progress. I want to welcome, where is she? Jazz.
Hi.
She's the new link for PPG. So if you're in a PPG, she's the girl to go to. So welcome, Jazz.
Hello, thank you.
Our board members are here. We've got Phil somewhere and we've got Christy. And they've done a sterling job over the last 12 months. So thank you to them too. And thank you to all the staff at Healthwatch, because they've done a brilliant job yet again this year with a great report. So now I'm going to hand over to our new Executive Director, Dr. Veronica Barry.
Thank you very much. We're just going to start the slides, and this presentation is really just a very quick overview of our active year in 2022 to 23. It's been a really busy year, but it's also been one of quite a lot of changes for us as an organisation and also for the wider health and care system. So without hearing from the people of Oxfordshire, we wouldn't be able to report and make changes. So also thank you for everyone who's given their input into Oxfordshire, and for all of our health and care partners who've facilitated us to enable patient voices to be heard. If you just want to pass to the next slide. So just for those who might not know or be so sure, Healthwatch Oxfordshire, we're part of a wider, there's every area has a Healthwatch, and our role is to listen to people who use health and care services and to make sure that their voices are heard by commissioners and service providers, and to identify and bring about improvements or change, and also to bring people into the design and development of services through working with community, with residents, and also with the health and care system partners. We act as a critical friend, and I think key to Healthwatch role is that we are independent. So our aims are really to support as many people as possible to have a say in health and care services and how they are developed and delivered, to ensure that everyone's voices are heard and not just the usual suspects, but also to make sure people who don't normally come forward are heard, and to work together to improve services. If you could move to the next slide, yes, thank you. So today, as I say, this is the highlights from a very busy year, 2022 to 3. We hear from people in all sorts of different ways, and we always change and develop the way we reach out to people to make sure that we do hear from them. So people can contact us and reach Healthwatch through telephone, through letter, through email, but also through our very active and full of information website, where people can leave a review of any health or care service that they use. And also we do regular surveys, which will be in paper form and also online. So the way we choose what we're looking at varies from picking up on what we're hearing from people when we're out and about doing outreach, face-to-face contact, pop-up stalls, and then also through responding to strategic changes in the health and care system and things we might have heard via health service providers. But very importantly, it's about patient voice. This year we heard from over 12,000 people sharing their experiences in these different ways. And through that, it's enabled us to reflect people's voices through places like the Health and Wellbeing Board or the recommendations of our reports, and feed them into the health and care system to make improvements or highlight patient voice. We've got a very small staff team. We're 7 members of staff at our best, and not all full-time. We've had a fantastic team of volunteers who support at all different levels, and of course our trustee input, all of whom are volunteers, and really contribute to the smooth running of Healthwatch as an organisation and its ability to deliver on its statutory requirements. We received a grant last year from Oxfordshire County Council, and this funding comes down from central government as established in the 2012 Health and Social Care Act. Every area's Healthwatch is funded in this way, although every Healthwatch is slightly differently set up and runs in different ways as well. So if you can move to the next slide. So as I said, we hear from people in all sorts of different ways, and we need to keep on our toes and keep improving and changing the way we respond and listen. So this year we have done, for example, some quite standard surveys working with Oxford University hospitals. We looked at the experience of patients leaving hospital with medicines and their understanding of what's called the patient medicines helpline. And this is a helpline that when people go home, they can ring into the hospital and get guidance on the medications they've been sent home with. We spoke to 112 people, and we found that of those 112, I think only about 10 or 11 had actually heard about the helpline. So we were able to really identify something quite practical, that the helpline wasn't fully understood and known about, and that knowing about it could improve health experiences. We also do more sort of innovative or different ways of hearing from people. So we'll be out on the streets quite a lot. And an example of this is our work focused on working men in Carterton. The reason why we were reaching men, working men, is because we know that men often don't come forward to share their experiences and often are reticent in their contact with health services. And we wanted to understand a little bit more about the barriers to this. So we spent, building on Oxfordshire Men's Health Partnership, 30 chats in 30 days. We went and had 30 chats with men in Carterton and had some amazingly quite in-depth conversations, hearing about what makes it hard for men to seek help for health conditions or seek professional help. Things like loneliness and isolation, but also working too hard or feeling responsible for their family so that they didn't look after their own health, or feeling that it took a crisis to take them to the health services. So that report was shared with the Men's Health Partnership and is building into some collaborative work this year around men in West Oxfordshire. We also have developed over the past 5 years an innovative community research approach. And this year was very much about sharing what we have learned with others. So for example, we developed a model of community research, which you can see on our website. And this was shared across all Healthwatch partners nationally as a learning tool about different ways to engage and involve seldom heard communities. Our previous community researchers, Omotunde and Najla, who had done projects with us, also shared their learning with Health Education England at a regional community research showcase in May. And we continue to support and hopefully, bring our learning into an emerging community research network that is taking place under Oxfordshire County Council Public Health. We also influence by holding roundtable events, and that enables people building on reports or insights that we've had to come together and talk informally, but also look at potential actions. So we ran roundtables on dentistry this year and on pharmacy. All of our research reports are available online, and they're all available in easy read and text form on our websites. If you'd like to move to the next slide. People always ask us, how do you know we've made a difference? And often it's hard to pinpoint exactly, and that's partly because of the complexity and vastness of the health and care services, but also because sometimes change takes a while to achieve, and it's about a process rather than a distinct outcome. However, that being said, our reports all do have recommendations, and service providers respond to those with concrete actions. And our enter and view reports are similar. But the longer term change that we have seen this year, which we would like to say related to our work. In 2018, we worked with East Oxford United Football Club, and we focused with them on a collaborative project looking at men from diverse and multi-ethnic communities about their understanding and uptake of NHS checks, health checks service. The recommendations came out of that, which included why not have NHS checks in community settings such as mosques or community centres, and make the process a lot more collaborative in the way that these are promoted and planned. So we're pleased to have seen that Oxfordshire County Council this year in 2023 have launched a new NHS checks service which does just that. It's taking NHS checks out into community settings. Another achievement for this year is the film with that Omotunde Coker made with women from Oxford on Black women's views of maternity care has now been taken up by Oxford Brookes University as a teaching tool, and we're hoping this year to increase that dialogue and perhaps bring some of the women in to speak to students directly about their lived experience. So that's me for now, and I'm going to pass on to my colleague Amir Alagab, who leads on enter and view visits.
Yes, thank you. I am Amir Alagab, taking care of enter and view visits. And the enter and view, as we are part of the Healthwatch, we have the power under the Health and Social Care Act 2012 to enter and view local health and social care services. Although some people are referring the enter and view visits as an inspection, but in reality, it is different. It is not an inspection. And the main purpose of the enter and view visit is to collect evidence of what works well and what could be improved, and also to gather the views of health and social care services users and families and carers, and to identify the best practice and highlight any area of concern. We mainly visited to report what we see and hear on the day to improve the quality of health and care system. And before publishing the report, we are sending our recommendation to the service where we visited to respond to our recommendation, and if they have any feedback, also to be included in the report, and all the responses will be published in the report. And the final report, we are sharing the final report with the health providers and commissioner and Care Quality Commission and public and Healthwatch England, who can carry out an enter and view visit. The enter and view visit, it is a special program, and it is conducted by a trained staff and volunteers called Enter and View Authorized Representative. Enter and view visit can take place only in specific areas, and that where enter and view visit conducted on premises only, where health and social care is publicly funded and delivered. Not all areas we can just conduct an enter and view. However, how to choose the area to visit? It is a mixture of what we heard from public and providers, to make visits, and also a reflection of the media, and also sometimes from the feedback center from our website. And that's the main idea and the reason for why we are conducting, and sometimes also to make a benchmarking for the best area, also to compare and make use of that. Enter and view visit outcomes. This year we made 11 enter and view visits, and we published 13 reports, that 2 from the previous year, and all the reports are available on our website. And we made visit to 3 GBs, Ancient Medical Center, Longhambra, and Banbury Cross Center, and 2 community pharmacies, Lloyd Pharmacy at Ancient and Longhambra, and 2 dental clinics, Oxford, East Oxford Dental Clinic at Mansell Way, and the Mira Bicester. And we have done also 1 care home, that's Banbury Height at Banbury. And we did 3 visits to Chipping Norton. The first one to the first aid unit, and then to the outpatient department. And also we visited the vaccination hub. Meanwhile, also we have conducted a visit to Oxford Community Diagnostic Center, which is a new service for the public in Oxford, the Business Park. Next slide, please. I will just give an example of a case study for one of our visits. We have done that one during last year, December 2022, for the renal dialysis unit at Churchill Hospital. In the day, we spoke to 14 patients and staff, and overall, we found the unit was very well led and provided excellent patient-centered care. However, whenever we are visiting, we are finding something to recommend or to observe, and that's when we have to report it to the health provider. And during this visit, we noticed that the signage could be better clear, and displayed information could be more accessible. And also some patients told us about they were very cold inside the building, and a few patients also mentioned that patient transport provided by the South Central Ambulance Services was not always reliable, and they're not satisfied with that. Based on what we written, actually we have written in that report 9 recommendations, and Oxford University Hospital NHS Foundation Trust took immediate action for some point, and also planned for some during 2023. Action taken immediately. They provide information highlighting how patient can access immediately that have taken, and they reviewed the ward temperature, and at the same time also raised reliability of patient transport service with the South Central Ambulance Services. And they plan to do some improvement during this year, 2023, to provide better signage in the building or out around the building, and to display details about how patients can give feedback and how Oxford University Hospital has responded to suggestions. Also to reorganize information on display and ensure it is up to date, because we found some information not up to date. And finally, to review the signage from the car park and within the unit. This is just a short example for one of our visits, but all details, and we have many really interesting case studies, if you please refer to our website. And now I will hand over to my colleague Vicky, the communication lead, who will talk about hearing from people. Thank you.
Thanks, Nick. So as Veronica has mentioned, there are lots of different ways in which we hear from people about their experiences and views of local health services. One of those is via our feedback centre, which is part of our website, and that is where people can leave a short anonymous review of their experience of using a local service, whether that's a doctor's surgery, hospital, pharmacy, care home. We then check and moderate those reviews and publish them on our website and send them on to the service provider so they can see the feedback and respond if they'd like. If they do respond, we publish their reply alongside the original review. In the last year, 327 people left a feedback centre review for 93 different services. This is a great way to ensure people's feedback is seen by those delivering their care. And it's also an important source of intelligence for us as it informs our other work, such as research projects and entering review visits. Another way in which we hear from people is by getting out and about. And this year, with COVID restrictions relaxed, we were able to once again enjoy a busy programme of outreach visits across the county. We visited shopping centres and markets, and also attended a range of community events, including Oxford's Eid Extravaganza, a Freshers' Fair, and an Older People's Day. These visits are a good opportunity for people to directly share their experiences with us, and also for us to raise awareness of our work and explain our role. We spoke to 663 people during these visits, and some of the common themes that emerged from conversations included access to GPs, NHS dentistry, rural and social isolation, digital exclusion, and continuity of care. What we hear highlights what's working well and what needs to be improved. And as with the feedback centre, common themes and areas that we pick up on may also lead us on to doing further work. This year, we were also able to restart our programme of regular visits to the 4 hospitals run by Oxford University Hospitals. That's the Churchill, the Horton General, John Radcliffe, and the Nuffield Orthopaedic Centre. Again, these visits gave people an opportunity to tell us about their experience of using the hospitals, as well as other health and social care services. Over these 4 visits, we spoke to 354 people, including patients, staff, and visitors. Feedback for the clinical care people have received was overwhelmingly positive, but some people did tell us about frustrations with parking, waiting times, and coordination between departments for patients who had multiple appointments. We passed on what we hear to the Hospital Trust, and we produced a report at the end of the year on these visits, which we sent to them, and they said they will use our report to make improvements. We're also always looking for new ways to engage with people and to hear their views, especially people we perhaps don't hear as much from. As an example, this year we worked with Oxfordshire Youth to hear the views of young people on health issues that are important to them. We supported Oxfordshire Youth to produce 3 episodes of their podcast series, Are You Listening? The topics for the podcast were chosen by young people who then planned, researched and recorded the episodes themselves. And these offer real insight into how young people want to be listened to by professionals, and they're well worth the listen. We can pop a link on the chat now so that you can have a look on our website if you'd like to listen. We'll share this podcast with health providers and commissioners, and we hope to continue to work with Oxfordshire Youth to ensure young people's voices are heard and to help us better understand what matters to them in terms of their health and care. I'm now going to pass on to Carol, our business manager, who's going to talk about the signposting service and the patient engagement work. Thank you.
Hi everyone, my name's Carol Ball and I'm the business manager with Healthwatch Oxfordshire, and I lead on information and advice, also known as signposting. So information and advice is a statutory function of all Healthwatch across England. If you look on our website, you'll see that we have a dedicated resource section where people can go and look in the first instance for information and advice about any services. People can email us, they can contact us by telephone, and we also have a live chat function on our website that people can use to contact us. I mean, to be honest with you, we get lots of requests and you know, quite straightforward requests, simple requests, you know, how do I register with a GP? I've moved area and I'm unable to find a GP in my catchment area. So it's quite straightforward to direct people to the GP within that area. Some GPs who were not taking on new patients, we were able to direct to the Bob ICB, the Buckinghamshire, Oxfordshire and Berkshire West Integrated Care Board, who commissioned GP services in Oxfordshire, and their patient services team were able to help people find a local GP. And finding a local dentist, a lot of calls were received were around dentistry. It is really difficult at the moment to access an NHS dentist. And what we have done with what we're hearing is we have raised that with commissioners of services. We've raised it at the Health and Wellbeing Board, and we've also raised it at the Health Overview Scrutiny Committee in Oxfordshire. So just, you know, ensuring that people's voices are being heard at the within the system where people can make change to the services on behalf of listening to those voices. I think we do get more complex requests, and we don't always know the answers, but we will try our best to find out. And thinking of something as simple as, well, not simple, we were contacted by a health professional who was supporting a Russian speaker in Oxfordshire who was really in danger of social isolation, because of Russian being their only language. And I say we didn't know the answer, but what we did do is we went away and found out some information. And so we directed the health professional to the Oxfordshire hub, and also to an organisation called the PERM Association, which is an association in Oxfordshire which supports Russian speakers. So, as I say, we don't always know the answer, but we do our best to try and find some information for people. We had somebody ring us who wanted to make a complaint about the quality of care for their child who was an inpatient at an eating disorders unit, and just really didn't know how to go about that. And what we did is we found some information for them. We talked to them about, you can raise it as an informal issue, so try and resolve it informally in the first instance. If they didn't feel comfortable doing that, we directed them to the PALS, the Patient Advice and Liaison Service. We also said they could speak to the Commissioner of the service, and also we offered them the information about the advocacy service should they not be in a position where they felt comfortable raising their concerns on their own and they needed some support to do that. I think we also attended a community champions meeting in Oxford, and at the community champions meeting it was raised that people were not sure on how to access interpretation services. So what we did was when we left the meeting, we went and we circulated information about how patients and service users in Oxfordshire can access interpretation services, and the outcome is that empowered people for whom English wasn't their first language. It empowered them to take control of their own health and social care by being able to communicate in a language that they felt comfortable in. I think it's also important to recognise, I think as my colleague Vicky said, that people are really happy sometimes, a lot of the time, the quality of the care they receive. And it's important that when people do contact us to tell us how good their care has been, that we also signpost those people to feed that back to those service users. For an example, I had somebody contact me about the 111 service, and I think I'll read, they said, "It was an excellent service and I will use it again if needed." And so what we did, we said, actually, that's lovely to hear, but do you know what? Feed that back to South Central Ambulance Service through their patient services team, because it's really good to know when you get something right. I mean, I'm not going to read from the slide, but you can see there that we had 335 people who came to us for information and advice last year. Can I have the next slide, please? Thank you. I think as part of the work we do in listening to people across Oxfordshire is that we work with patient participation groups across the county, and that, patient participation groups are where patients, carers, service users come together to work together to improve the service. So sometimes they're seen as a critical friend, and sometimes they just work together to ensure delivery of a service. So I'm thinking of maybe, we will have, a lot of people will have gone and had a COVID vaccination over the last couple of years. And a lot of the people who supported the GP practices in delivering the COVID vaccination programme were members of their patient participation groups. So, helping organise the queues, directing people where to go, that was all volunteers, those patient groups supporting the practice. I think we attended 19 PPG meetings last year. I think one of the things we did is that we had a joint event with the Rycote practice over in Tame, where we had a stall in Tame Marketplace, where the PPG just held an information event to talk to local residents about what a PPG was and how to get involved. And I think that's really important. It just empowers people to make sure that their voice is being heard. I think how do we support PGs internally is that if you look on our website, we have a dedicated resource for PPGs. We send out regular news briefings. And, you know, we try and encourage the patient groups to share best practice across all of the PPGs. We help practices where they don't have a PPG. We will support them to establish a PPG, or where maybe the PPG has not been functioning over the last couple of years. We will work to help re-establish. And one of the areas we've been working in is with Luther Street. We've been helping to support them to re-establish their PPG, which was quite active up to a couple of years ago, and it just needs a bit of a refresh. So we've been working with them to try and do that. I think one of the other things we do is that, you know, we do patient webinars, so just open forums where people can come along and listen to, you know, different topics of the day. And I think one of the ones we did sort of over the recent 6 months was we did a webinar that was supported by the Primary Care Network for Wantage, and that was about who else can I see at my GP practice, because you'll all be aware that, you know, there are lots of different roles now at your GP practice as social prescribers, your pharmacy expert, clinical pharmacist. So there are lots of new roles, and sometimes, you know, we don't always need to see the GP. Sometimes, you know, the clinical pharmacist is best placed to help you. So we ran a webinar which we just talked about, you know, those different roles at GP practices and how they can support patients. And most recently, I think in March, we held a webinar which was about how health and care is changing in Oxfordshire. So how the landscape is changing for everybody. And it was really an information webinar. And we had a guest speaker who was Dan Levison, who was the place-based director for Oxfordshire. And he came and gave a really informative presentation, which was well received by those attending. And he also took some questions and answers at the end of that. So it was really quite a good meeting. And just to be aware that, you know, all of our webinars are available on our website. So please do have a look. So thank you for listening to me. And I'm going to hand over now to the chair of our board, Mr. Don O'Neill.
Thank you very much, Carol. I'll be brief so we can go into the questions and answers. But firstly, I just want to say thanks to Sylvie, obviously, who's done a great deal of work, not just over the past few years, 2 years as the chair of Healthwatch Oxfordshire, but also as a trustee before that as well. And this past year has been a year of change for us as well. So well done, Sylvia, for doing so good, and good to hear also that you want to stay on for a while as well. So that's really good. And also, I think just a big thanks to the staff. I'm always amazed just how much work we get through. You come to a time like the annual report, and it doesn't just show the quality of the work, but also the quantity as well. There's so much work gets done. And as Veronica said, it's only a very small team, and they're not always full time, but so much great work gets done. So thanks to all the staff for doing all that really good work. You can see in the slide the priorities ahead. You know, it means more work for the staff, and I'm sure that again do really good stuff. I'm quite excited to see how the next year turns out and the kind of work we produce as well. For myself personally, I'm really interested in the community research projects. I was really amazed by the work by Omotondi and is it Coca? What name? But I just thought it's really great work and a really good innovation. I'm looking forward to seeing the outcome of those projects as well. And I think also, yeah, just looking forward also as a chair to work with other health and social care services throughout the county during my time as chair. And hopefully things will go smooth over the year, and yeah, we'll have some even more success. And you'll join us again for the next annual report in a year's time. I'm going to hand back now to Veronica, I think, for the Q&A session. Over to you, Veronica. Yeah.
Thank you. That's great. It's good to see all the work that we've been doing over the year. But as I say, do read the annual report because it really does bring it to life. And just also to acknowledge that a lot of this work was achieved under the leadership of Rosalind Pierce, my predecessor as ED. So thanks to her as well. So we're going to open the floor to questions now. You can either attract attention of us by physically raising your hand, or you can use the hand raised thing in Zoom, or you can put a question in the chat and we'll try and respond to that. So do we have any questions? I can't see who's asking questions.
Sue Frayling Cork is asking a question,
Okay.
Veronica.
Sue, would you like to ask a question? And bear in mind, if you don't want to be videoed, you can turn your video off while you're asking your question.
That's fine. Thank you very much for your time. I asked Dan Livingston in March about the progress of communications between the hospitals and the GPs with emails. This problem is still ongoing and exacerbating a lot of patient anxiety, GP frustration, and actually, quite frankly, dangerous practice, because they're not getting the information from the hospital consultant out in time. So perhaps somebody could address this problem.
Yes, it's not something I can provide an answer to, but we can certainly speak to. Yes.
Hi, sorry.
Yes,
Hi, my
okay.
name's Helen Wood. I'm the
yes.
head of quality from Oxfordshire. So we have a system whereby we receive feedback on that type of issue. There is a interface, or what's called an interface meeting between primary care and the hospital. If you want to, I'm happy to give you my email address and email the specific details, and I'll speak to Dan as well about what he picked up, and we'll see if we can take forward your concerns.
That would be most helpful. I feed this back to my WI members in the village,
Brilliant.
which goes back around the village as well. So since we have 70 members, it would be very helpful.
We need some specifics, but I'll put my email address in the chat. So thank you.
Thank you very much. Thank you.
Thank you, Helen. It's great to have you here to answer that question. And just to say that I also attend the place-based partnership meetings, which is a forum where hospital and GPs are there, and Dan Levison as well from the Integrated Care Board. So we can raise that at that meeting as well. Thank you. So are there any other questions? No, no questions in the chat. No.
Yeah, there's another question from Makina. Can't hear Makina though.
Makina, would you like to ask a question?
We can't hear you, Makina.
I think, are you on mute?
It's not on mute, but I don't know if
No.
your microphone's plugged in or you're on that.
If you'd like to put the question in the chat box, we can
Okay.
answer it that way. Don't worry, she's saying she doesn't want to ask a question. I wanted to know about the community research toolkit is being shared, so I can talk about that. We developed a community research model that we called it a model, and that was to share among the Healthwatch network. It's on our website available. If you look on our website, we've got a section called community research where you can see the model. You can also see a video of our community researchers we've worked with speaking. And it's something that we're continuing to do. At the moment, we're also doing a piece of work around gathering the views of what communities see as community research to feed into the emerging network that public health is leading on. So it's a sort of ongoing thing, but I'm very happy to talk to you about it another time if you'd like to know more, but do look on our website for those resources.
Thank you.
Hi, yes. Is there, would anyone else like to ask questions? So at the moment, we're working with 2 community researchers this year under the second phase of the Health Education England programme. and they are having training from Reading University and the Scottish Community Development Association, and we act as hosts to support them on the ground in realising their research projects. So as we do this, we're learning a lot of skills about, one, the challenges of community research, but also how it can bring real voices to the fore as well. So we're very happy to share our learning with that.
Thanks, that's brilliant. We're doing trying to do a bit of community research, so it'll be very interesting.
Yes, yeah, flows in the park.
Yes, I work with flows, so I said that.
Yeah, great. Any other questions? Is Robert asking a question? No. Okay. Yes, Sue.
Sorry, it's me again, but my pharmacist, the chemist in the village, is tiny. It's grossly overworked. I wondered whether or not that anything can be, if you could do a visit and see just how they're managing to cope with. I mean, we've had a lot of extra building in the village, like most Oxfordshire villages. And the amount of prescriptions and stuff they have to now process is enormous, and it's tiny.
Yes, so Sue, we, as I said in the presentation, we did we've done quite a few focuses on community pharmacies and their role and people's understanding of that. We also held a roundtable discussion with health service commissioners and providers in the autumn. The other thing to say is please do raise these things through our review function on our website, because the more we hear about these issues, the more we can feed them back to the system. So we do pick up on that, and we're aware that this is not only a problem locally, but there are quite a lot of challenges with community pharmacies across the county at the moment. There is a review of the needs assessment for pharmacy taking place as a result of some of the changes that are happening. So we do keep a tab on that and raise it where we can.
Thank you.
Could I just answer? Robin Williamson has asked a question in the chat, and I'll read it out. Do you check successful practice in other parts of the country? Channel 4 last night covered new work in Leicestershire, where the aim was to improve social care and hospital, I think. It sounded and looked very useful for improving bed blocking by a large percentage. So we, as Healthwatch team, do look at other examples and try and keep abreast with improvements and changes that are taking place. There's a lot with the new integrated care boards. There is a lot of focus on improving the way that health and social care is delivered around the person, and that communication between services are happening. So when I attend the place-based partnership, for instance, there is a lot of discussion around just these issues. It's around how Oxfordshire as a whole health system can work together to unblock these blockages across the system. And that's about social care, the hospitals, GPs, primary care, pharmacies, all communicating and working around the patient to do that. And Oxfordshire has got a number of initiatives in place that are built on good practice elsewhere. For instance, virtual wards, it's piloting at the moment, where people will be at home receiving clinical care. So those examples are there. And I think I've just got an aeroplane going over. I think what we do as a Healthwatch is try and share those examples of what we hear from the system back to people, and through, for instance, our webinars as well. So yes is the answer, but the system is certainly always looking to improve by taking models that are modelled in other integrated care board areas. Were there any other questions? No. So our new chair, Don O'Neill, spoke about some of the priorities that we've focused on, and just to say just a brief little bit about how we select our priorities for the year, and that's through a number of sources. What we did in December and January was a call out to people to give their priorities to us, the public. And we heard from, I think, over 200 people there with their views. We also sort of respond to strategic changes and to things that we've picked up in our research as we're going along. And that helps us to set our sort of work programme for the year. We are going to be focusing again on rural isolation. We're working with a local voluntary group to do a specific piece of work around that. We're going to continue to support this and develop the community research approach. And as I said, we're working with 2 community researchers this year. We've got other areas of focus, which include the support to patient participation groups. And we have been doing sort of pop-up surveys, which we've just produced one on long COVID, for example. We've got one at the moment, which you might like to contribute to, on what does joined up care mean to you? That's on our website, so please do contribute to that. And then as the year goes on, we will highlight other areas as well. And it takes a while sometimes to locate exactly what we're looking at and to plan our approach. We're also going to be doing more outreach and continuing with our enter and view visits. So thank you, everybody. I'll if nobody has got any more comments or feedback to us or questions, I'd like to thank our trustees, volunteers and staff, and also to you, people of Oxfordshire, for all of your support to bringing the voice of people who use services into change and improving and praising the system where it is working. And thank you as well to all of our health and social care partners who respond to our suggestions and reports. And we hope this year we will continue to support people to have their voice heard.
Veronica?
Yes.
Can I just say thank you to you as well, because you really do kind of reach the parts that we don't manage to reach, and we find that feedback really, really valuable. So keep it coming. Thank you. It's hugely welcome.
Thank you. That's nice to hear.
I'll also come in at that point and say, on behalf of Oxfordshire County Council, we also really value the work that you do. So extending a huge thanks from us as well.
Thank you. So you can always leave comments or feedback on our website about how we do as an organisation, and we'll be running a survey again to gather people's views about what they think our priorities should be. We do hold open forum board meetings where you can meet our trustees 4 times a year. And we're going to continue doing the webinars. So there's lots of different ways, and we're always open to new ideas as well. So please, if you've got other ideas about how we can reach people or what you think we could focus on, please do contact us. And do read the annual report, because it's great, and it's available in easy read and text, and our website has a translation format as well, so you can translate it into any language you need. All right, so thank you so much, everybody. We'll say goodbye. I think we'll draw this meeting to a close now.